Welcome, and thank you for taking the time to attend this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will cover menu measure number 2, incorporate diagnostic lab test results. Let's get started. First, let's open up the PDF from the MTBC website. This is the eligible professional meaningful use menu measure set measure number 2 out of 10. Incorporate clinical lab test results into the EHR as structured data. And here the measure is for more than 40% of all clinical lab test results which are ordered by the provider. They should be entered in a structured data format into the EMR. The exclusion is any eligible professional who does not order any lab test results or whose results are not in a positive, negative, or numeric format during that EHR reporting period. There are no additional definitions here, but the attestation requirements are numerator, denominator, and exclusions. So the denominator will include the total number of lab test results ordered by the provider during the EHR 90-day reporting period that are in positive or negative formats or as a number. The numerator would be the number of lab test results that are incorporated as structured data into the EMR. The exclusion, as we said, would be any provider that does not have any ordered tests or their test results are not in that specific format. So that resulting percentage must be more than 40% for the practice. There is some additional information down here about the specifics for this measure. As we've seen with the other measures, that you're allowed to exclude any results that are not maintained electronically in the EHR. So any results for patients that are not coming in electronically. And the structured data does not necessarily have to be exchanged. So for example, if you have an electronic lab connection with your local LabCorp or Quest, then that would automatically be an exchange of data and it would automatically be electronic. However, it does not have to be. So for example, if you have someone who keys in your lab results as structured data, that also will suffice. When we talk about structured data, we do not mean results received by fax or that come in as a scanned image. We mean individual numerical data values assigned to each lab result. Let's take a look at how this is achieved through the MTBC EMR. First thing, let's find our patient through the EMR. Here we have Esther Johnson's account. And let's go directly to her clinical section. Lab results are stored in the plan of care, and we can click on the option for lab orders. When we click into lab orders, we can see all of this patient's available results chronologically over time. So if there are labs that have been performed multiple times for this patient, we can see the change and the graphing of those results over time. Lab results are ordered by date and also have an indication of high or low results that are outside of an expected range. The labs are also grouped into categories depending on the type of result. The ranges and units are also displayed here. These results have come in electronically from the local lab company. If we want to know the detail of a certain result, we can simply double-click on that result to go directly to the results screen. Additionally, you can also graph results over time. Graphing results over time allows you to see the details for that patient's specific lab test result over the course of many dates. Implementing lab orders and lab results through the EMR will also require that you submit orders electronically, which would be a change in your current workflow if you're utilizing paper lab requisitions. Submitting an order electronically to your lab will require direct connectivity from the MTBC EHR. Please call the MTBC Tech Support to see if your current and local lab qualifies for electronic setup with MTBC's EHR.